There is an organization in this country which is there to help people, who feels for them and who tries to understand them.
At the Medicare Rights Center, we believe that healthcare is a human right, and the Medicare program is the bedrock of health security for older adults and individuals with disabilities.
Medicare Rights Center, this is Beth.
We answer over 20,000 questions a year on our helpline and help people save over $6 million in Medicare costs and prescription drugs. We've seen an increase in demand for our services as a result of the COVID-19 pandemic. People are calling us who've recently lost their job and who need help affording their Medicare coverage and enrolling into Medicare. It's strange seeing it this empty. I miss seeing the staff and the volunteers. Usually this helpline is bustling. I miss, just seeing everybody's face. I remember in early March, there was so much uncertainty about the coronavirus, and the information was, changing hour by hour and day by day. People were scared. Staff were concerned about one another, concerned about the volunteers, concerned about our clients.
If I don't have my medicine every day, morning and evening, my pressure rises, and that is threatening. My husband has had bypass of all 4 arteries, etc.
Because of my underlying condition, like heart disease and glaucoma and other things, I was very vulnerable. I am still vulnerable for COVID-19.
So the health insurance was extremely important for us because of how vulnerable we are.
Older adults and people with chronic conditions are the most vulnerable to complications from COVID-19. Our organization plays an important role in the safety and the health of our community.
After COVID hit, we got a letter from social service that we had no health care. One doesn't want to die in that kind of condition. I mean, if you die, you die. But, because you don't have medicine, because you don't have access to any kind of other help, that is a terrible death.
It's more important than ever that people remain insured. And if they're uninsured or underinsured, it really can have devastating consequences on their lives.
There was nothing wrong with our certifications, with our documents. It's only that information hadn't got to the right people at the right place. Our cases fall through cracks and nobody knows how to help us. Nobody's there to help us. It is only by a lucky chance that we came across Medicare Rights. It was such a change when we got to the Medicare Rights that we really understood. The letter was shocking, the letter was shattering, but they didn't let us get shattered. Their firmness, their faith in what they were doing, that helped us keep our own beliefs up.
Our staff help people troubleshoot complicated cases. We help people appeal denials of health services, denials of drug coverage, and help them enroll into programs that lower the cost of the prescription drugs and pay for Medicare costs.
Hi, you've reached Beth at the Medicare Rights Center.
The Medicare Rights Center transitioned to telework arrangements quickly in early March. Even though we can't physically be in the office with one another, we have not missed a beat with helping people during this pandemic.
Medicare Rights helped us. They knew where to go, they knew what to do. They stood by us every time. And I cannot emphasize it enough.
It always feels wonderful to know that we've been able to help somebody access their prescription drugs and to know that we played a role in keeping them healthy.
The relief, it is a huge relief. Somebody who hasn't been through it cannot understand. However much I express it, you don't know what it feels like. At last somebody understands, at last somebody cares, and there is a friend in this country who is ready to help us. Thank you again, Medicare Rights.